Hi, I'm Amy Mahali from Be Well Clinic, and in this video I wanted to do a little bit of discussing about supplements. So there are different ways to think about supplementing and how to introduce supplements, which one should you do, and we're not going to talk about all of them. But in terms of taking supplements, I wanted to discuss a couple different things. First off, there is the argument of, do you add one supplement at a time, or do you do the whole program that maybe was recommended to you, and which one do you do? Because if you do it one at a time, you can definitely know what effect each one has, but if you do them all at once, my experience shows sometimes you need multiple for them to work. And so if you only do one at a time and take it out and transition to another one, and you're only ever doing one, you may miss some of the benefits that some of them have because they actually need to be taken together. So when I'm recommending supplements, which I prefer food, but sometimes we need the denser nutrition for the depletion and deficiency that a body has, if I'm recommending supplements, I try to explain which ones go together. So calcium lactate, for example, and cod liver oil go really well together, and we try to discuss that. The other thing I try to tell people is which ones are what I consider foundational. So liver and cod liver oil and minerals and fermented foods or probiotics, so depending, maybe a supplement for you, those are foundational things. We all need to eat those things. They may be in the form of a pill, they may be in the form of raw liver pieces or mineral salt licks where you're just eating pinches of salt through the day. But you need those things. So when those are missing in someone's diet, I always recommend adding those because we need them. And you can add all of them at once unless you're worried about a reaction. If that's true, add one at a time in small amounts and then work up. And then add the next one, but you keep the first one. So you build and build and build on top of it. If you're doing lots of new supplements, say you got muscle tested or someone gave you a protocol based on what they think that you need, what could be good is that same thing, building one on top of the other. But keep in mind, some supplements work together. And so trying to do research about which supplements are cohesive with each other, which ones might not show an effect. And some supplements take a while for you to see what's happening. This is especially true when you're trying to affect your hormones. In most things, when someone's doing a hormone supplement, not a hormonal supplement, but something to support their hormone function, I tell them it could take up to a month for that effect to be fully there. And if they're not seeing that effect, then we could talk about whether it's a good thing for them or not. Some people see an effect in 1 or 2 days, but to give it at least a month for hormones or neurotransmitter support before you say that definitely didn't work. And again, this is dependent on the cofactors. If you're supporting your serotonin production, for example, a 5-HTP supplement is really common. You need many B vitamins, many minerals, and if those aren't present, your 5-HTP is probably not going to be very helpful. So that's the first big section of when do you do all of them? That can be overwhelming to the body for sure. Do you do one at a time? It's not my favorite. Do you add one at a time and build on it? That probably is often a good idea, depending on how sensitive you are in your body. So that's topic 1. Topic 2, let's talk about the depletion amount that your body may have and how fast you can increase your supplements. So a really common thing that people will say to me is, I felt so good for the first week or 2 that I started the supplements, and then they stopped feeling good. I stopped feeling good, they stopped working. And they either stayed on them because they just kept a schedule, or they cut them out because they felt like they weren't doing anything anymore. When they cut them out, usually they actually had a regression and a return of those symptoms. So what's happening here? Why did they feel good those first couple weeks and not more? Or the question that I get also, am I going to be dependent on this? And the answer when we're talking about food and minerals and vitamins that are real is yes, you are dependent on minerals and vitamins. All of us need minerals and vitamins. So if you have a food or a food-based supplement that is helping you function at the proper or closer to the proper way of functioning, you are going to feel worse when you take it away. That is not the same as a medical dependency to a certain medication. This is just that your body says, you've promised me this thing and you're going to keep giving it to me, but then you take it away. There's going to be some kind of relapse on that because your body was giving and using, it was giving an effect as it was using what you were giving it. On top of that, there's another effect that can happen. Sometimes when people really, really need a vitamin, like let's say B vitamins, which I always recommend liver-based B vitamins, never synthetic and never methylated. If you have a B vitamin deficiency that's pretty severe, and then you start adding as much B vitamins as you need day one, it's going to be chaos in your body. Your heart's going to get so much B vitamins, you'll probably feel anxious. Your liver's going to get tons of B vitamins. It'll start detoxing all the things it hasn't done for weeks or months or years. You are not going to feel good if you increase your supplements too much, especially when you're very depleted. So here's the metaphor. If you have a deficiency in your company of 5 employees, do you hire all 5 employees at once? No, it would be chaos, right? If there's only 10 of you working and you hire another 5, there will be no one to train them, not enough people. The jobs are already kind of getting done, even though everyone's stressed out. So what do you do instead? You hire 1 or 2. When they have worked there for a while and they've been trained, they're going to pick up the workload. And for a while, you're going to feel amazing. Oh, so much relief. And then things are going to get busy again because you really do need 5. So then what do? Do you say these supplements aren't working? These employees are no good? No, you say it's time to hire the next ones. So this is the way that I have started using to describe, hey, if you're taking supplements, I think you actually need a lot of B vitamins. We did a heart sound recording, or we listened to your heart, or whatever it is, and we saw a deficiency. But let's start with a few employees, right? Let's start with a little bit and build on it. And eventually you're going to hire all 5 of those employees, but we can't start there. It's going to be chaos. That seemed to be really helpful for people, so I wanted to share that part as well. I hope that these ideas have been helpful. Just a couple of the many ways that you need to think about supplementing. Again, food is first, food-based supplements are next, and listen to what your body needs. But hopefully these ideas will help you understand what your body's asking for and what you should be doing. The third idea I want to just briefly mention is that a lot of people are taking too many supplements. Some people are definitely not taking the right amount of support and nutritional support for their body, but there are people who will get a supplement that was so good for them, but then they keep it on. And then a new problem comes up and they get a new one, and they end up taking a lot, 20, 30, 40 supplements a day. Our bodies do not need that, except in very rare circumstances. And even if you do, 40 at once is too many. Your body can't deal with all of that. It's good to go, hey, my body did need that thing. It did make me feel better, but it was like hiring a temp employee for a job that was backlogged. And then when the job's done, you don't need it. You caught up. You can maintain now with your normal employee base. So think about different supplements that way. Food is always foundational. Those 4 categories: organ meats, fermented foods, animal fat, dense animal fat, which includes cod liver oil, and minerals and mineral salt are things we need all the time. But on top of that, the little extra things you may still need and you may not need them. So I would encourage you to go to your medicine cabinet and see which things would I be okay without. If I were allowed to only pick 3 supplements, what are my top 3? There's different questions you can ask, but go and evaluate the supplements you're taking. It is detrimental to your body to take more than you need. It is difficult on your gut to process any supplement, so we don't want to take more than we're needing. I hope those 3 concepts are helpful for you. There's, of course, way more to talk about in terms of supplements, but these are things that I hope will help to guide you as you are listening to your body and figuring out what you should be taking and what you shouldn't be taking, why you feel certain ways when you start and later on, to quell the fears about dependency. If you like this video, please like and subscribe to the channel. It's really helpful and it helps these videos to be shared to more people. Please also share this with anyone you think that could be helped by it. And if you like this, there's lots of other topics like this, other metaphors and simple explanations on our channel. So go check out those videos. I hope that this is helpful to you. I'm excited that you watched this video, and I will see you in the next one.